Medication errors. Most medication errors occur as a breakdown in the system rather than a fault of an individual. There are key things in preventing errors. One is reporting of the error, right? So whenever an error happens, it is very important for nurses or for any personnel to report those errors. That way we can prevent it from happening in the future. Also, reporting of potential errors. So let's say it didn't happen, but it almost did. It is still very important to report those because that way we can prevent those errors from happening, especially if there are patterns. Now, you also have non-punitive approach to error reporting or just culture. This allows nurses and other medical professionals to report those errors without feeling scared to get in trouble. Then we also have cues and initiatives that help guide and set standards in preventing medication errors. Preventing and responding when a medication error occurs. One thing to remember is this saying, to err is human. So in 1999, there was a report by the Institute of Medicine that basically brought medical errors to the public's attention. There were 7,000 deaths per year related to preventable errors. 3% to 6.9% of hospitalized patients experienced medication errors. Two follow-up reports from the IOM found that there were really no significant change in rates of preventable errors. Medication errors. Preventable. Most, if not all, medication errors are preventable. They are a common cause of adverse healthcare outcomes. The drugs commonly involved in severe medication errors include the drugs that affect the central nervous system drugs, anticoagulants, and chemotherapeutic drugs, which is why it is so important to have a second licensed professional co-sign or double-check those drugs. Again, there is more potential for harm with high alert medications. Now, we're going to see SALAD or LASA. So SALAD stands for sound-alike, look-alike drugs, or also known as LASA or look-alike, sound-alike drugs. There are medications that sound alike and look alike that we have to be aware of. These medications are often confused with each other, which causes a higher likelihood of medication errors. So some examples include buspirone and bupropion, prednisone and prednisolone. And again, medication error prevention. So I have to emphasize that most medication errors occur as a breakdown in the system rather than being the fault of the individual. Again, there are keys to preventing errors: reporting of the errors, reporting of potential errors, non-punitive approach to error reporting or just culture, and some cues and initiatives. Medication errors and adverse drug events. Adverse drug events are basically any undesirable occurrence related to drug administration or failure to administer. So this includes medication errors and adverse drug reactions. So again, adverse drug events includes medication errors and adverse drug reactions. Medication errors. So what are medication errors? This is any preventable adverse drug event involving inappropriate medication used by a patient or healthcare professional. They may or may not cause the patient harm. So regardless whether it caused harm or the patient experienced some complications from that error, it is still considered a medication error. So if somebody gives the wrong drug and the patient felt fine after that, it doesn't negate the fact that that's still a medication error. Adverse drug reactions. They are unexpected, unintended, or excessive responses to medications given at therapeutic dosages, such as opposed to overdose, which is another type of adverse drug event. An adverse drug reaction includes an allergic reaction and idiosyncratic reaction. So what's the difference? Allergic reaction is often predictable. An immunological reaction resulting from an unusual sensitivity of a patient to a certain medication. This is a type of adverse drug event and a subtype of adverse drug reactions. Idiosyncratic reaction, on the other hand, is any abnormal and unexpected response to a medication other than an allergic reaction that is peculiar to an individual patient. So this is basically a response Let's say a patient receive a medication and they start having palpitations. Let's say this is not a common effect of the medication and it just happened to this specific patient. That's considered idiosyncratic, and this patient is not having an allergic reaction. It's not part of an immunological reaction. As we mentioned earlier, errors are usually caused by something wrong with the system rather than the fault of a certain individual. There are issues contributing to errors. Now, errors can occur during any step of the medication process. So it can be during procuring, prescribing, transcribing, dispensing, administering, and monitoring. Now, most of us nurses, we play a role when it comes to, let's say, transcribing, just because when we're getting telephone orders. That's why it's very important to repeat that order. So if we're getting a verbal or telephone order, we need to repeat it. Now, if possible, you want to avoid getting telephone orders, especially if it's not an emergent situation and the doctor or the provider is going to be there soon anyway. And also dispensing, administering, and monitoring. So usually we're also part of that. There are, again, some organizational issues that are a possible cause of those errors. A reason would be, let's say, you're working at a hospital and they're short-staffed, or you are assigned to a unit where you've never been oriented to before. That's part of an organizational issue. There are also educational system issues. Now, let's say I, as your instructor or professor, teach you, let's say I teach you that you don't have to do the 6 rites at all. You don't have to check. Or also or if I fail to tell you that you have to check certain things and you go on and start practicing as a nurse eventually, that will be considered part of the educational system issues, right? It's a failure within the educational system. Now, there are also sociologic factors that can cause medication errors, and one of the most common one is the use of abbreviations that aren't approved to be used. And sometimes even abbreviations that are approved to use and it's just basically another person misinterprets or is unaware that that's what it means, then that can cause some errors. You may hear the terms near miss and close call. Those are 2 different things. So they're not necessarily the same, although I know some people will use it interchangeably. But what is near miss and what is close call? Near miss is an event or situation that did not produce patient injury, but only because of chance. This is still considered a medication error. So basically, just like the example that I gave you earlier, let's say you gave the wrong medication to this patient and it just so happened that the patient was fine after that. That's a near miss. It's still a medication error. However, the patient nearly missed that complication. So that's what a near miss is. Now, a close call. A close call, on the other hand, is an event or situation or error that took place but was identified and captured prior to reaching to the patient. An example that I tell my other students, there was this new nurse, actually proud to say she's a BC graduate. She was a new nurse practicing. At the time, it was her first year being on her own, and she needed a medication called amiodarone, which is a medication for an irregular heart rhythm, commonly AFib. She was supposed to get amiodarone, and I believe she ended up getting a different medication. Now, she was preparing that medication, and luckily, she double-checked. What happened is, at the pharmacy, they ended up printing the name amiodarone, and they put that label on that bag of medication and covered the actual name of the medication, which is the incorrect one. In that case, while she was checking it, she caught it and called the pharmacy and did all the process, reported and whatnot. Anyway, so this specific one is a close call. So there was an error, right? So there was still an error, but it did not reach the patient. So there are many strategies to minimize or prevent errors. One of them is awareness or speak up. So if you see something wrong, say something, right? And then now we have the computerized prescriber order entry. Back in the day, we used to get paper charts and the doctors would write the orders. And sometimes, depending on their handwriting, it may be very difficult to decipher what they actually wrote. So thankfully, now we have the computerized system that we use, and it's so much easier to read those, right? Compared to trying to decipher, especially some doctors would have very poor handwriting. And then also we have the barcodes and scanning devices. With the use of that, if you always scan your medications, for the most part, there's a very, very, very little likelihood that you are going to give that wrong drug. Again, other than unless, kind of like the example earlier, if somebody puts the wrong label and you scan it, I mean, it's going to say, yeah, you scanned the right thing, but if you didn't check the bag that's actually the right medication, that may still cause some errors. But for the most part, though, if you follow that and you scan the barcodes, those are actually really good safety checks to ensure that we actually have the right drug for that patient. Now, we also have automated dispensing machines. So an example of that is a Pyxis machine. And lastly, effective communication. When you're talking to somebody, if you can't understand what they're saying, just politely ask them to repeat it. And in addition to that, again, if you're obtaining a certain order from a physician or nurse practitioner, PA, or somebody, right, a provider, make sure you repeat what they say. Repeat that order, read it back to them, to make sure that you're all in the same page and that you're talking about the same exact medication, the same dose, route, etc. Now, these are basically a list of things. These are ways to prevent medication errors. So as you can see, there's so many of them. And again, I just want to emphasize that part of it would be the 6 rights of medication administration and should be used consistently. In addition, you also have 2 patient identifiers. So what are those? So whenever you're giving medication, it's not enough to call them by their first name, right? You want to know, ask the patient, who are you? Name, let's say my name, Deborah Stan Gill. So you want the full name, and in addition to that, you need a second identifier. So usually you would want to ask their birthday, and it's very rare that you have the same patient, same patient's name with the same birthday. But in case, occasionally it can happen, sometimes you can go by the medical record number. But in general, it's enough to have patient's full name and date of birth. Very important things, and you're going to learn more about this when we're going over some medication calculations. Never use a trailing zero with medication order. What do I mean by trailing zero? It's basically a zero after a decimal point. So do not use 1.0 milligrams. Instead, if it's exactly 1, then just put 1 milligram. Don't put a 0.0 because that will just confuse somebody, and somebody may not even see the decimal point there and they may think it's a 10. Again, somebody can misread that, and 1 versus 10, that's 10-fold dose increase. So you don't want that for your patient. In addition to not using trailing zeros, you also want to use all the time a leading zero for decimal dosages. So anything less than 1, and if it's a decimal, then you want to put a 0 before the decimal point. Do not use 0.25 milligrams. Instead of that, you would want to put 0.25 milligrams. Again, 0.25 milligrams may be misread as 25 milligrams if you don't put that 0, and that's actually very dangerous. Take time to learn special administration techniques. So if you're not familiar with a certain administration technique for a certain route, definitely don't just do that for the first time on that patient. Make sure you know, you practice, and you ask somebody who actually knows how to do it. Again, always verify new medication administration records, read the labels. Anyway, so read all this. And one thing that's also very important, and that's why we also focus on that when it comes to this course, is using generic names to avoid sound-alike trade names. So a lot of the trade names may sound alike, but generic names are quite unique per se. So it is very rare to have generic names that sound alike. Again, for this course, you are not responsible for trade names, but you are responsible for knowing generic names. And that's the same when it comes to your NCLEX or licensure examinations. So you would want to know the generic names. As we talked about earlier, it is very important to report medication errors. When an error happens, you have to report to the prescriber and also your nursing management, or basically just follow your policies and protocols when it comes to medication errors. So some hospitals will have different policies when it comes to reporting, like who to report to and where to report and all that. And also you have to document the error per policy and procedure, and you have to have factual documentation only. What's the medication that you administered? What's the actual dose? Any observation, any changes in the patient condition? And also part of that documentation, and obviously you have to do it as well, you do it and then document it, that the prescriber was notified, and if they ordered anything, if there's any follow-up orders, you may want to document that as well. And there's also external reporting of errors. So some hospitals, organizations are required to, or they sometimes voluntarily report to certain agencies such as the United States Pharmacopoeia Medication Errors Reporting Program. There's also MedWatch, which is sponsored by the FDA. Then you also have the Institute for Safe Medication Practices and JACO, or the Joint Commission. And as much as it is very important to prevent adult patient medication errors, it is even more important to prevent pediatric errors. How do we do that? You will help prevent those kind of errors if you obtain and document accurate weight, and that should be in kilograms. Report all medication errors. Know the drugs that you're giving. Never ever give a drug that you don't know about. Even if you don't know it by heart, you don't have it memorized, please read about it before you even give that to the patient. Also, you want to follow the 6 rights of medication administration. Avoid verbal orders in general. Avoid distractions, and communicate with everyone. And when it comes to medication errors, there are also ethical issues. One would be notification of the patients, because some providers and some professionals will be very hesitant to report those errors in fear of litigation and how the family members or the patient would react. But part of our responsibility is, if an error happens, is to report it to them, to notify them that that had happened. There are possible consequences for nurses, and that may be a reason why some nurses keep quiet and basically don't report certain errors, because they're scared of any possible consequences, which can include disciplinary actions at work, possibly losing their jobs, and ultimately possibly losing their license, and on some occasion there is a possibility for a criminal charge. So those are the things that make it very hard for certain people to report those errors. We'll go over it a little bit more in class. People are going to be different about it, but the rule of thumb is be truthful and always follow your policies and protocols. Medication reconciliation. It's a procedure to maintain an accurate and up-to-date list of medications for all patients between all phases of healthcare delivery. This often happens at least during admission, transfers, and at discharge. So this thing is continuous assessment and updating of patient medication information. Medication reconciliation involves 3 steps. So one is verification. This is when patient medication information is collected with a focus on medications currently used, thus including prescription drugs as well as over-the-counter medications and supplements. This is verifying what medications are these patients on. Next is clarification. This is a professional review of the information given to ensure that the medication stated by the patient is actually appropriate for that patient. Next is reconciliation. This is further investigation of any discrepancies and changes in medication orders. Medication reconciliation is the process in which medications are reconciled at all points of entry and exit to or from a healthcare entity. Patients provide a list of all their medications they're currently taking, including herbal and over-the-counter drugs. The prescriber then assesses the medications and decides if they are to be continued upon hospitalization, and this should be done at each stage of healthcare delivery. So what do I mean by that? This needs to happen during admission when there's a status change. Let's say the patient status changes, now the patient is critical, or the other way around, the patient is now stable. That medication reconciliation should happen then. And also when there's a patient transfer within or between facilities or provider teams. So if the patient, let's say, is transferring from ICU to the telemetry unit, then a medication reconciliation should happen. And last but not the least, you also have to have medication reconciliation happen at discharge. The latest medication list should be provided to the patient to take to his or her next healthcare provider.